Some journeys aren't defined by a destination, but by their transformation. From passionate beginnings to defining milestones, the Pakistan Cardiac Super League became the heartbeat of academic excellence. Two pioneers joined forces once again to ignite the spirit of learning and leadership. What began as a challenge became a movement. In every round, a new hero emerged. In every team, a story was written. Now, the legacy continues as 16 elite teams step into the arena to prove their strength, their skill, and their synergy. Team LNH Pelicans, Team SGTH Tigers, Team BVH Cardinals, Team FIC Fighters, Team SICVD Thunders, Team AFIC Lions, Team PIC Hawks, Team Dow Dolphins, Team NICVD Kings, Team RIC Dreadnoughts, Team Looms Falcons, Team MIC Panthers, Team AQH Stars, Team BMC Strikers, Team HMC Stallions, Team PIC Warriors. Guided by the visionary stakeholders of the Pakistan Cardiac Society, steered by the Governing Council, the backbone of PCSL. Judged with fairness and integrity by our panel of expert umpires, and held together by the voice of reason and brilliance, Dr. 𝐏𝐚𝐤𝐤𝐬𝐿, our moderator, whose pivotal presence made this league a resounding success. Glory goes beyond borders. The winning team will earn a prestigious opportunity to participate in an international cardiology event. Mark your calendars, the battle for brilliance begins August 9th. Pakistan Cardiac Super League, Season 3, the ultimate test of knowledge. Powered by Wilson's Pharmaceuticals.
Assalamu alaikum everyone, I'm 𝐏𝐚𝐤𝐬𝐬𝐿 and I'm honored and privileged to welcome you all in Pakistan Cardiac Super League Season 3. After an exciting and thrilling first quarterfinal match, we are once again back in action for the second quarterfinal match, which is going to be played between PIC Warriors from Peshawar and SICVD Thunders from Karachi. Just to update you, AFIC Lions have already won their match, and to a winner of today's match will be playing the first semi-final match against AFIC Lions. Before moving forward, I would like to introduce the council members and umpires of today's match. We have with us two match umpires, Professor Mohammad Ishaq Saab and Professor Abdul Hamid Siddiqui Saab. We have also with us Professor Amber Ashraf Saiba and Professor Javed Akbar Syal Saab. And last but not the least, I would like to introduce the voice of Pakistan Cardiac Super League, Dr. 𝐏𝐚𝐤𝐤𝐬𝐿 Saab. And I would now request Dr. 𝐏𝐚𝐤𝐤𝐬𝐿 Saab to please start the formal proceeding of today's match. So over to Dr. 𝐏𝐚𝐤𝐤𝐬𝐿 Saab.
Thank you very much, Hamza. And it is high time. And I'd like to take this opportunity to first of all welcome you to this most amazing third season of Pakistan Cardiac Super League, which is brought to you by Wilson's Pharmaceutical in collaboration with Pakistan Cardiac Society. Now we know that we are into the quarterfinals, and it's going to be the second quarterfinal, which is going to be held between SICVD, Sindh Institute of Cardiovascular Diseases, Thunders, and they are up against PIC, Peshawar Institute of Cardiology, Warriors. So let's see how it goes. We have seen some wonderful matches, as they've mostly been pretty outstanding just because of the fact that the scores were pretty high, and they've been fighting it out. They've been very well prepared, and that's such a wonderful sight to see. So before we move on, important things first. We have our faculty members on board. Our umpires, as always, we have Professor Muhammad Ishaq Saab. Welcome, sir. It's great to have you, like always. We have Professor Abdul Hamid Siddiqui. He's the other umpire that is with us, and he's been pretty great as well, like always. And the rest of the faculty members, extremely important. We have Professor Amber Ashraf with us. She'll be joining us. We also will be joined by Professor Javed Akbar Syal Saab, and I think we'll have the introductions as we move on. So with this, we now move towards the two teams. And I'm going to ask one of the teams, so can we have SICVD Thunders on the screen, please? And I'll ask the captain to go for the introductions.
Assalamu alaikum, sir. Sir, myself, Dr. Shadba, to my right is Dr. Takveen, and to my left is Dr. 𝐏𝐚𝐤𝐬𝐭, and extreme left, Dr. Taha.
That's great. So I hope you are pretty well prepared today for the fight.
Yes, sir.
All right. Great to hear that. Keep the spirit up. Good to see, 3 girls and a boy. Again, I think that's pretty good. I'm sure we'll have a tough fight today. So best of luck to you. And with this,
Thank you so much.
we move to Peshawar now. And we have the Warriors waiting. Captain, introductions.
I'm the captain of PIC Warriors, myself Dr. Bilawal, and to my right Dr. Azhar, and to my left Dr. Osama and Dr. Burhan.
All right. So how do you feel, Warriors?
We're pretty much confident.
Okay. So best of luck to you. And I'll request
you.
everyone else to keep their mics on mute so that we do not hear the crosstalk. Okay, now. So, as we know, the sun is shining pretty bright. The weather looks good. And the pitch seems to be pretty fast, a bit bouncy. Let's see what happens. So, do I have the permission from the faculty to start the game? Sir?
Yes, Amjad. Go ahead.
Thank you very much, sir. And with this, can we have the coin toss, which is going to be done electronically? Bring it on. And I'm going to ask PIC randomly, PIC Peshawar. Again, a lot is based on luck. So what do you want? Heads or tails?
Heads.
They want heads. Roll the coin, please. And it's a head. So PIC Warriors, you won the toss. And again, as per format of the game, you will have 2 questions to face. The first one, do you want to throw the questions or you want to take the questions?
We would like to throw the question, sir.
Okay, you want to throw the questions. And the second question now, which scenario would you want to pick? Case A, case B?
Case B.
Case B, all right. So the news from the center is PIC Warriors have won the toss and they have chosen to throw the cases, and it's going to be case B that they've picked up. All right. So with this, we are now going to move towards the first case, case B, and I'll request the Warriors to start it by going through the Winnie. Can we have it on the screen, please? Read it, please.
A 38-year-old woman presents with acute onset severe central chest pain lasting for 1 hour, occurring at rest 6 hours ago. She is a smoker but otherwise healthy. ECG shows non-specific T-wave inversions in the anterior leads. High sensitivity troponin I is 500 nanogram per liter. Coronary angiogram reveals mild diffuse atherosclerosis with up to 30% luminal irregularities in the LAD and RCA.
Okay, so I'll give you a couple of seconds. SICVD's Thunders. Let me know, Thunders, when you're ready. All right, Thunders, are you ready?
Yes, sir.
Okay, the Thunders are ready. Let's bring question number 1 and read it, please.
Question number 1. OCT of the LED is performed. Which of the following is true? Option A, only supportive evidence OCT would reveal plaque disruption in 20% of the cases. Plaque erosion in situ thrombosis or single coronary artery disease type 3 is possible. Option C, cardiac MRI is more likely to detect an ischemic mechanism than OCT. Option D, medical therapy, dual antiplatelet and statin is recommended regardless. Hence, OCT is of limited value. Option E, OCT is contraindicated in suspected stable coronary artery disease due to the high risk of distal embolization and vessel rupture.
All right, so you've got 60 seconds to answer the question. And with this, I also take the opportunity of welcoming Professor Amber Ashraf. She has joined us, and Professor Javed Akbar Syal has also joined. Welcome. It's great to have you. So we would all like to hear the discussion. So keep your mics unmuted, please. Thunders. 20 seconds to go. Come on. 15 seconds. It's a pacey pitch. 10 seconds. Come on.
We'll go with option B.
B beta.
Yes, sir.
Okay, so they are saying B beta. Are you sure about it?
No, sir.
They're not sure. Okay. They want me to lock B beta. They're not sure. Let's see. And you're rightly sure, even if it's less than 50%, but the answer is 100%. Very well done. Great start. A wonderful 6. It was an outswinger, and over the bowler's head it goes for a wonderful 6. Great start. You really get us excited. Okay. Can we have question number 2 on the screen, please?
OCT of the LED showed stable coronary artery disease type 3, but finding best distinguished it from atherosclerotic plaque rupture. Option A, disrupted fibrous cap with lipid pool. Option B, absence of necrotic core and presence of double lumen sign. Option C, dense calcium arc of more than 90%. Option D, thin cap fibroathyroma. Option E, overlying red thrombus.
60 seconds on your screen.
Spontaneous coronary artery में double lumen होता है. So we'll go with option B.
Okay, so which option? Come again.
B, sir, B.
B beta.
Yes, sir.
You've come down the wicket, going for a 6 over long on, and it seems as if you like Bs, B betas. Are you sure this time?
Yes,
don't be sure. Okay, they are sure. Let's see what happens. Lock B beta. Oh my goodness, it's a 6 again. Even when they are sure they are right. So that's wonderfully done. Well done. So we are in for another hat trick. We've seen a lot of hat tricks in the past. We will be having 3 in a row. If you get this question number 3 right, bring it on the screen, please.
Regarding the pathophysiology of the SCAD, which statement is most accurate? Option A, it originates from the vasa vasorum rupture leading to intraluminal hematoma without intimal tear. Option B, it results solely from an intimal tear with communication to the false lumen. Option C, it always occurs on the background of fibromuscular dysplasia. Option D, it is primarily triggered by cholesterol embolization. Option E, it involves immune-mediated endothelial necrosis.
60 seconds is what you'll get.
Originate from the vasa vasorum, let's say, leading to intraluminal hematoma without intimal tear. It results solely from intimal tear with communication to the false lumen.
False lumen से तो होते नहीं है, true lumen से नहीं होते. This could be right. Hematoma का I'm not sure.
Pathophysiology.
Communication to the false.
Solely from the intimal tear with communication to the false lumen.
So you've got 25 seconds.
I'm not sure about it. बताओ क्या करें?
Approaching 15 seconds. It's a short pitch delivery moving away from them. What are they going to do? 10 seconds. Come on. We need an answer. 6. Answer.
We'll again go with option B.
Oh my God. They again want to go with option B beta. Are you sure? 50-50? What's going on?
50-50, sir.
50-50. They are saying it's B beta. Lock B beta. Let's see. And that's the first mistake. No, you can't always go for Bs. You have to learn. But I guess, never mind. You can still have many more hat tricks, and we hope so that you do. So moving to question number 4.
In a woman with angiographically mild lesions and elevated troponin, when should OCT be avoided? Option A, when there is heavy coronary calcification. Option B, when the patient is hemodynamically stable. Option C, when intercoronary thrombus is evident. Option D, when type 3 lesion is suspected. Option E, when there is high suspicion of stable coronary artery disease with preserved TIMI3 flow and high and risk of propagation.
And the timer starts now, 60 seconds.
अवॉइड करने से इंटरवेंशन वो इंटरवेंशन नहीं करते ताकि वो प्रोपेगेट ना हो
डाले थे मैंने वायर तो डाली थी वायर तो नहीं डाली
नहीं शूट किसी भी अवॉइड करना तो प्रोपेगेशन से रोकने के लिए ना
ये प्रिजर्व ऑटोमेटिक फ्लो भी है हमारे पास तो हम ठीक है so we'll go with option E.
Which option? Say it again.
E.
E epsilon.
E, sir. Yes, sir.
Okay, they are saying E epsilon. Let's see what happens. I'm going to lock E epsilon. And yes, that's the right answer. I'm glad you went for this one. Very well done. Great. So you've definitely spent some time in your cath labs. Good to see that. Brilliant. Okay, moving to the next one. Question number 5 on your screen.
What is the most common type of spontaneous coronary artery dissection based on angiographic pattern? Type 1, type 2, type 3, type 4, type 2B.
Okay, 60 seconds are on your screen. So do we have them on there? I can't hear anything. I can't see them as well. Okay. Okay, unmute, please. We can't hear you.
Two. We are not sure about it. So we have to go with that.
So we'll again go with option B, type 2.
क्या मेरे किस्मत बोल रहा प्लीज हाँ
नहीं
Sir, option B.
20 seconds.
Option
Which
B,
one?
beta.
Option B, sir.
B beta, your favorite B, right?
Yes, sir.
Okay. So now again they say it's B beta. I'm going to lock B beta. Lock it. And that is absolutely correct. Great answer. Wonderful 6. Straight drive for a huge 6. And with this, I think we've had 5 questions in total. And again, you're on a hat trick. So 4 correct answers. Great going. Wonderful play. Good to see. It seems as if I'm sitting in the cath lab. Great job. Okay. Question. And by the way, I am with my scrubs. So, question number 6 coming your way.
Which statement about the timing and risk of SCAD recurrence is most accurate? Option A, recurrence usually occurs within a year. Option B, most recurrences affect the same segment. Option C, median recurrence interval is 3 years, often is different artery. Option D, recurrence risk is less than 1% after 6 months. Option E, beta blockers increase recurrences by reducing coronary blood flow reserve.
Start the timer, 60 seconds coming your way.
होता नाइट्रेट्स में होता बीटा ब्लॉकर कम देता है नाइट्रेट्स में बीटा ब्लॉकर नहीं देते
सी होगा
Different artery में होता है.
हो सकता है
इसके इसमें हो गया
इरेगुलरिटी जिसमें आरसीडी भी थी और उसमें भी
नहीं, ये स्पेशल
वैसे तो अलग है
वैसे most of it is
अभी सच्ची हमें नहीं आता तो कर देना या मुझे लगता है whenever we are seeing movies that means that is wrong मुझे लग रहा है C would be the most appropriate yeah I would go for C I think so.
So we'll go with option C with uncertainty.
Okay, so tukka laga rahe hain, maine suna tha. So I think you are saying it's C Charlie. You've been pretty honest about it, I think. So you want me to lock C Charlie, right?
Yes, sir.
Okay, so from a very honest team, it is C Charlie, lock it. Let's see. And honesty wins. Once again, and this time it's your hat trick. Well done, well done. It's a huge 6. Great answer, great answer. All right, so I think, you know, when you pick randomly, you still need to use your mind. So I think you have the mind in the right direction. But with that, having said, I think PIC Warriors are also, they're buckling up and they're going to have a go at this. I'm sure they'll give you a tough fight because right now we are heading for a good total. So it's a score of...
Dr. Hamza, I don't like these terms, uncertainty and not sure. Even if they're not sure or they are not certain, they should not say this because that reflects their indecisiveness, and that's not good for a doctor or a physician or a cardiologist. So even if they are not sure, they will say, yes, we think this is the right answer.
Very right, sir. I think coming from the master himself, he's got such a keen eye as an umpire because this is a very small picture right now. We are looking at a much larger picture, which is, you becoming physicians and cardiologists and interventionists. So I think Ishaq Saab has got a very extremely valid and important point there. So still, you have to keep your hopes high, you have to be confident, and I think the luck's going to go your way. With this, we move to question number 7. Madam, you want to say something, please? Yes, ma'am,
Yeah.
you want to say something?
I'm saying definitely what Professor Ishaq Saab is saying, we fully endorse that thing. That's very pertinent. That's very pertinent.
Thank you very much, ma'am. As always, ma'am is there. And these are words of encouragement for you as well because you guys have played really well. And you need to be confident because somewhere at the back of your mind, something is there which tells you that this is the right answer. And that's your training and knowledge. So well done for that. And with this, we move to question number 7.
Which vascular condition should always be screened for after stable coronary artery disease? Number A, option A, Marfan syndrome, Takayasu arthritis, option D, fibromuscular dysplasia, option D, giant cell arthritis, option D, thromboangiitis obliterans.
All right, clock 60 seconds and let's see.
The most common cause is hypertension की. ठीक है.
उसमें तो वीनस आर्टरी के नहीं पता हूँ.
अब ये मार्फन सिंड्रोम है या फिर फाइब्रोमस्कुलर डिस्प्लेसिया.
ताकि मैं सुनी होता था वो भी फीमेल में मोस्ट कॉमन, लेकिन मैंने उसमें स्टार्ट नहीं पढ़ा.
वो ज़्यादा बच्चों में होता है. ये सी में मैं कंफ्यूज हूँ बस.
मार्फान तो मैंने कभी नहीं देखा स्टार्ट होता.
इतने स्कैड आते हैं माथा में.
फाइब्रोमस्कुलर डिस्प्लेसिया के
We'll go with option C,
25
Charlie.
seconds to go.
So option C, Charlie.
Okay, option C, Charlie. Are you sure you want me to lock it? Pretty confident there?
Yes, sir.
Okay, they are saying they're confident. Lock C, Charlie. And you're absolutely right. You have to be more confident there. Yes, it was absolutely the right answer. Well done. Great job. So, you're ticking, all the right boxes at the moment. Just one blemish so far. A score of 36, and we've got 3 more questions to go. Okay, question number 8 on the screen.
A patient with healing SCAD is seen at 8 weeks. What follow-up imaging approach is most appropriate? Option A, repeat coronary angiogram at 4 weeks. CT coronary angiogram at 3 to 6 months interval. Stress echo after every month. Routine OCT at 6 months. No imaging unless recurrent pain.
Okay, 60 seconds. Start the timer, please. And okay, unmute yourself here.
इनको मैं पता किस तरह का हो रही है. सवाल इसमें व्हाट फॉलो अप यूजिंग अप्रोच इज मोर
हो सकता है ना कराते हैं. Why would we go for this step? नहीं हो सकता है ना कराते हैं. पर लिखा हुआ है
25 seconds to go.
बताओ वो दे दो जी. हम करते, हमने कभी नहीं किया. मैंने
Come on, we are approaching 15 seconds now. 10 seconds. 6, come on. 5, 4. Which one? Oh, no. My God, you took so much of time. Okay, I'll have the umpires on this. Can I have the umpire's decision here?
I think we can take the answer.
Okay, sir. So, what's your answer? Quickly.
B, sir.
B beta?
B. Yes, sir.
Okay, their favorite B beta They were very close. I think it must be in microseconds, but the umpire has spoken. So we give you this one, B beta. Lock it. And that's the right answer. Come on. What took you
And
so long?
This is with a piece of warning as well.
Yes, yes, very right, sir. So you have to go for it. Just don't wait till the last second, because you have to pick something. Don't waste your questions. That's my advice to all of you. Okay, we are moving to question number 9. Read the question, please.
At 6 months follow-up, repeats coronary CT angiogram shows complete vessel healing. She has no atherosclerosis and normal lipid profile. She remains on aspirin and clopidogrel since hospitalization. Which of the following statements regarding her long-term antiplatelet management is most appropriate according to the current evidence and expert consensus? Option A, continue dual antiplatelet indefinitely to reduce recurrence risk, since recurrent SCAD events often arise at different sites. Option B, stop all antiplatelets after 12 months as vessel healing eliminates thrombosis risk. Option C, continue aspirin monotherapy beyond 12 months. Discontinue clopidogrel now, since long-term DAPT may increase bleeding risk without proven SCAD recurrence benefit. Option D, switch to P2Y12 inhibitor monotherapy to avoid aspirin-induced endothelial irritation and promote vessel healing. Option E, add low-dose rivaroxaban 2.5 mg BD to aspirin for secondary prevention of SCAD recurrence per compense-like approach.
Okay, 60 seconds. On your way, and make the most of it now.
So we'll go with option C. C, sir. C for Charlie.
Okay, are you sure about it? You've taken a long leap forward and going for a big 6. So I should lock C Charlie then.
Yes.
Okay, so let's lock option C. Very well played. That's another one. Wonderful. Great answer. Great answer. Very well done. So with this, we move to a score of 48. And we just have the last question of this innings left. It's already a good total. It's a fighting total, I would say. Can we have the last question on the screen?
Same patient managed conservatively for 2 years with full recovery, left ventricular ejection fraction of 60%. She is now planning pregnancy. Which of the following statement best reflects current recommendations? Option A, future pregnancy is contraindicated due to high risk of recurrence, SCAD. Option B, pregnancy may be considered after multidisciplinary counseling and complete vascular imaging to exclude fibromuscular dysplasia or other arthropathies. Arteriopathies. Option C, pregnancy is safe without restriction once LV function normalizes. Option D, antenatal anticoagulation with low molecular weight heparin is recommended to prevent recurrences. Option E, routine cesarean section at 37 weeks is advised for all post-SCAD pregnancies.
You have 60 seconds to answer this.
देखो मुझे बताओ एंडोवास्कुलर डिस्प्लेसिया कितने चांसेस होते हैं ना प्रेगनेंसी में जैसे हाइपरटेंशन एंड मलेरिया वगैरह तो आई थिंक सो प्लीज तो ज्यादा बेहतर है और ये सी के लिए कह रहे हैं
कार्डियोलॉजी में मल्टीडिसिप्लिनरी में ज्यादा रोल होता है तो बी
So we'll go with option B.
Okay, so you've again come down the wicket. A half tracker. Is it going for a 6? Are you sure about it?
Yes, sir.
Okay, so which one? What should I lock?
B, sir.
B beta.
Yes, sir.
That's your favorite. You want to close the innings with a B as well. Okay. All right. Lock B beta. And that is the right answer. It's a wonderful 6. Beautiful play. And with this, we have come to the end of this first innings. And they've put up a wonderful total of 54 with just one mistake. 9 correct answers. Great, great play, I would say. Wonderfully done. And it was great to see because this was all interesting stuff, something that happens in the cath labs, but we all come across it. So brilliant. With this, I move to our panel of experts, our umpire, to start with Professor Ishaq Saab.
Thank you, Hamza. What a wonderful inning. Great performance by SICVD. And I think one mistake, I don't know how it happened, but I think they have made a wonderful score. Very good discussion among themselves. And all praise for them. So excellent performance. Let's see how the other does. And again, the scenario was very good. The questions were very pertinent. And it means, as you said, they have spent some time in the cath lab. Well, cath lab is the center of gravity in cardiology nowadays. So everybody revolves around the cath lab. So I think I'm very glad to see the score. But I wish and I hope that Peshawar does the same and beats the score, which is quite difficult, quite a big score, by the way. But we had teams in the past with similar scores. So congratulations to SICVD. Well
Thank
done.
you very much, sir, for your comments. And, we can say that it's time well spent in the cath lab as well. So it's a good total, no doubt about it. And we have our other umpire. It's Professor Abdul Hamid Siddiqui Saab. Sir, what do you think?
Thank you very much. Very fighting total put on by Thunders, and the scenario was very good. Although we see it rarely, but it's an important topic. And all the questions were very, very comprehensive. So I think that PIC have to act as warriors for the sake of their name. Let's see how they put on.
Very right, sir. Let's see. I think it's going to be a good game. We may be in for a nail biter because I know PIC, they're fighters, and it's a wonderful total, no doubt. But we hope for a good match, and we have Professor Javed Akbar Syal Saab. Sir, your thoughts? What do you think?
Thank you, Hamza. Definitely, it's a great honor for me because I'm heading SICVD and it's probably a youngest team. And I'm very glad because probably they made a record in PSL. You are associated with this PSL for a very long time. So probably 9 out of 10 is correct as a record till yet, I think. Correct me, Hamza.
Sir, it's a good total, but we have seen 10 on 10s as well. So they are right up there. Yes, this year, in this season, we have had this twice, 10 on 10s. And we've also had 14 out of 15 as well. So the teams are really fighting it out well this time.
Okay, so that's great, and I wish best of luck to PIC people. Let's see, the game is going to be nail biting. I think it's like last night ODI with Pakistan, Sri Lanka, Pakistan and South Africa.
Yes, no doubt. So Pakistan is in a habit of making easier things quite difficult. I hope they don't do the same.
Yes, Ishaq Saab want to say something.
Yes, sir, please.
Yes, Professor Syal RCB. I would like to compliment him for his leadership, and he must be proud of the team which is participating today. Girls against men from Peshawar. So I think Javed Akbar Syal should be happy, and the performance was excellent. And all credit goes to him for training these youngsters and making a great tradition in our province of Sindh. Well done, Professor Syal. I am very proud of you.
Thank you very much, sir. Thank you very much.
Very right, sir. I think it's congratulations to you, and definitely things are great in your cath lab for sure. And we have Professor Amber Ashraf. She's on her way somewhere. Ma'am, how do you like it?
Thank you very much. It's a really very exciting, wonderful match. I really enjoyed it, and especially B for Beta. That was something कि दम किया हुआ है B for Beta पे. But that's really nice. The scenario is wonderful, and as Professor Ishaq Saab has just highlighted, cath lab is very important. But it shows how our youngsters been trained on all these things, mashallah, and they are doing a wonderful job. And congratulations to Professor Dr. Syal as well. No doubt he's doing a wonderful things. And now see how our Peshawar team is going to look after this match. But Hamza, your moderation is super, and it's really give energy to all of us. And we enjoy all the academic session, and salute to Wilson's Pharma as well. Thank you very much.
Thank you very much, ma'am. You know, it's actually what keeps me going is the presence from our mentors and the faculty. That actually keeps me going, and I see the young blood coming in, and they are coming in so good this time around. So with this, we now know what the score is, and it's a pretty tight score. It's a high score of 54 that has been put up, and PIC, well, I know they are up for it. They are fighters, and they are known to be fighters from that region. We all know that. And SICVD Thunders came up with a wonderful performance, and with this, PIC Warriors are going to chase it down. We will find out. So with best of luck to both the teams, can we have the scenario on the screen, please? And I will request SICVD to go ahead and read it.
8-year-old doctor, known case of diabetes and hypertension with history of PCI to LED and left circumflex in 2024, presented with complaints of central chest pain of 12 hours duration associated with sweating and dyspnea. On examination, his heart rate was 110 beats per minute, blood pressure was 90 by 60 millimeters of mercury. Chest examination revealed bilateral crepitations, peripheries were cold, ECG revealed T-wave inversions in precordial leads, and troponins were elevated. Echo showed akinetic LV apex.
Okay, so I'm going to give Warriors a couple of seconds to get ready for it. They can let me know when they're ready. Okay, so are you ready, Warriors?
Yes, sir. We are good to go.
They are good to go. And can we have question number 1 on the screen, please? Read it, please.
As per SKY classification of shock, what is the stage of shock?
Read the options A, B, C,
Option A,
D, and E.
Option
Okay.
B is B, C, and
Okay,
D.
I've done it for you. Your 60 seconds start now. You can have the scenario back if you want to see it. And I will request Warriors to unmute themselves. We want to hear the discussion.
In shock with the crepitations, kinetic segments. Either it's B or C. Is this one was shock? Okay, can I also like sickly with that? No, I was the mood with another crepsugana.
25 seconds to go. Warriors, come on. 15 seconds.
Go for it. Option Charlie, sir.
C, Charlie. Okay, you want me
C,
to lock
Charlie.
it?
Yes,
And
sir.
I'll ask you, how sure are you this time?
I am 100% sure.
He's saying he's 100% sure. Okay, lock C, Charlie. And that's a wonderful answer. Brilliantly done. You were right all the way. I could hear B, C, B, C. But you chose the right one. Well done. Great start. Beautiful 6. That's what we are hoping for. A good game. A fighting game. And with this, we move to question number 2.
Which of the following hemodynamic parameters is suggestive of stage C shock? PCWB of 14, PAPI of 1.8, CPO of 0.75, cardiac index of 2.7, none of the above.
All right, 60 seconds on your way.
Cardiac index cannot become out as he totally can't exist. It's more the 14 दिन type of shock that is in it has ज़्यादा पका है आपको पता नहीं सी CPU से नहीं next I'm confused between option D and A.
25 seconds.
What do you say? D. I'm not in this D.
15 seconds. Approaching 10 now.
Delta, sir. Option Delta.
D, Delta. You want me to lock
Yes,
D delta?
yes, sir.
Okay, I am going to lock D delta. And that's the first mistake. Oh, on the second question, in fact, the third question. No, sorry, it's the second question. And that's your first mistake. Now, you know what this means. Now, you can tie if you correctly answer all the questions. And I hope that we get there and we get into the super overs and, it goes on, because we really want all of you to do well. And with this, I think it's getting tighter. You've got to be watchful now. Question number 3 coming your way.
So which of the following is the strongest hemodynamic correlate of in-hospital mortality? Pulmonary capillary wedge pressure, pulmonary artery pressure index, cardiac power output, cardiac index, or the ratio between RAP or pulmonary capillary wedge pressure.
Okay, the timer starts now. You've got 60 seconds to answer this.
Right atrial pressure with PCW, that side. It shows the in-hospital index. Index or no, it become the ratio side मुझे कम दे आओ ना राइट atrial pressure side पे नहीं बात तो ताकि कल तेरा ratio वाक लेगा ना नबी इन hospital mortality दूसरा right pressure निश्चित होता है
25 seconds.
Option E, epsilon.
Okay, so are you sure about it? You want me to lock E, epsilon?
Yes, sir. Yes, sir.
Okay, so they are saying lock E, epsilon. Lock it. Oh, that is the second mistake. My goodness, my goodness. Another wrong answer. And now we know the outcome of this match and the quarterfinal that we have in our hands. So you had very small margins, but we know that we still have to play for it. We still have to go till the end. We need to know all the answers and you have to give it your best shot. So never mind, but we'll move to question number 4. All right. Read it.
4 is patient is started on inotropic support. Which of the following medications has the greatest potential to worsen patient's tachycardia? Option A, norepinephrine. Option B, epinephrine. C, dopamine. D, dobutamine. E, milrinone.
Timer starts now, 60 seconds.
Shock the para, worsen the patient's tachycardia. I mean, shock option está quando a munga de cam de inotropic support inotropic support de musera de cam de norepinephrine dopamine dobutamine norepinephrine de cam de dopamine de cam de that is tachycardia look at clinically de mo gore gana dopamine de
25 seconds.
25 seconds na wala kill B ko shock akana A or C
15 seconds. Come on, Warriors.
Option C, Charlie.
Okay, so they are saying it's C, Charlie. Let's find out. Lock C, Charlie. And that's the right answer. Well done. Great answer. So you thought about it. Teamwork was there. And it's a great, great answer. Well done. Beautiful hit. Nicely done. All right. Question number 4 coming, in fact, question number 5 coming your way.
Question 5. The patient underwent coronary angiography that revealed patent stents and mild diffuse stenosis in distal PLV branch of RCA. LV-gram was done that showed akinetic aneurysmal apex with LV apical clot. Which is the likely diagnosis? Option A, NSTEMI with recanalization of PLV. Option B, type 2 MI. Option C, troponin leak syndrome. Option D, Takasugu cardiomyopathy. Option E, none of the above.
All right, you have 60 seconds to answer this.
Aneurysmal apex picture previous elite Western take there instant picture. Any leak syndrome nothing to do with apex plot from it's stress induced play. Delta, sir.
25 seconds.
Delta.
Delta.
Option D.
Okay, so
Yes.
how sure are you with D delta?
I'm sir 80 to 90% sure we are.
80 to 90%. Okay. So he's going for the long off boundary. Lock D delta. Let's see what happens. And he's absolutely right. Well done. You had to be 100% sure. Well done. Well played. Great going. This is what we want to see. I think Madam wants to say something.
I think it's great. There is a good spirit of fighting and it should continue.
Very right, ma'am. We all know that people from the north, they are warriors and they truly are warriors. So wonderful, wonderful spirit. Great going. And we'll have question number 6 coming your way now.
Which of the following echocardiographic findings is most specific of Takotsubo cardiomyopathy and a key component of inter-TAC diagnostic criteria? Option A, global hypokinesis with severe reduction in LV ejection fraction. Option B, apical ballooning with hyperkinesis of the basal segments. Option C, mid-ventricular wall motion abnormality with apical sparing. Option D, apical ballooning with hypokinesis of basal segments. Option E, mild ventricular wall motion abnormality with apical involvement.
All right, 60 seconds.
Beta.
Oh, that's
Option B.
Afridi is out of the crease, right? B beta.
Yes, sir.
He's
Yes,
taken
sir.
it on the full toss. He's going for the straight drive, and he wants me to lock B beta. Okay, lock B beta. And yes, so B beta can work for everyone. As SICVD Thunders, can you see it worked for them also? Well done, well done. So B is the thing of the day. Well done, very well played. Wonderful answer. Great going. Okay, we are moving to question number 7.
Which combination of cardiac biomarkers and ECG findings, despite mimicking an acute coronary syndrome, is most characteristic in a typical presentation of Takotsubo cardiomyopathy? Option A, high elevated troponin I and deep symmetrical T wave inversions. Option B, modestly elevated troponin T and persistent pathological Q waves. Option C, markedly elevated BNP or NT-proBNP and transient ST segment elevation. Option D, highly elevated CKMB and prominent R waves in V1 and V2. Option E, normal troponin and profound QTC prolongation.
And the timer starts now.
Now, mark BNP over yakam diziyati and ST elevations over transient. Option Charlie, C.
C Charlie. Should I lock it?
Yes, sir. Yes, sir.
Okay, so I'm going to lock C Charlie. Let's see what happens. And a beautiful stroke. He flicked this one over square leg. Wonderful stroke. I think that's the way to go. Well done, well done. Had a few stutters in the start of the innings, but I think they are coming out all guns blazing now. Well done, Warriors. You're playing it really well. Good to see that. Okay, 3 more to go. Question number 8 is on the screen now.
Question 8. Which of the following is predictor of poor prognosis in Takotsubo cardiomyopathy? Option A. Which of the following is a predictor of... Sorry, this is the question. So, option B, female gender. Option C, physical stress factor. Option D, emotional stress. Option E, both A and C.
All right, 60 seconds is all you have.
Sir, what is option A?
Okay, so just hold on. Hold the timer here, please. Hold the time. I just want to ask the technical team. Do we have an option A here? It's male gender. So it's a misprint there. Option A is male gender. I'll start the timer again.
It's female.
Okay, continue.
So B.
Continue the
Beta.
timer, please.
It's beta, sir.
Are you sure about it?
Beta.
B beta?
Yes, sir. Yes, sir.
Okay, B seems to be the order of the day. Lock B beta. And this time it's the wrong answer. Okay, that's another miss. You could have taken your time. You still had more than 30 seconds to go. Okay. With this, we move to question number 9, the second last question of the day.
That's enough. Which of the following is the least common type of Takotsubo's cardiomyopathy? Option A, apical. Option B, mid-cavity. Option C, basal. Option D, focal. Option E, RV.
Okay, 60 seconds on the screen now.
See, the more apical basal focal activity. Option C, Charlie. Basal.
Option C, Charlie. Okay, you want
Yes,
me
sir.
to lock it?
Yes, sir.
Okay, he says lock it. Lock C, Charlie. And very right. That's a beautiful stroke. And nicely done there. You took your time, thought about it. And you know, when you were about to answer, in your eyes, I could see you were 100% sure. So, well done. Well done. So, we're moving to the last question of this match and this second quarterfinal. And this is question number 10 coming your way.
Given the patient's history, what should be the antithrombotic regimen for this patient? Option A, aspirin plus clopidogrel. Option B, aspirin plus ticagrelor. Option C, aspirin plus prasugrel. Option D, clopidogrel plus apixaban. And option E, aspirin and apixaban.
Start the timer. 60 seconds is what you have.
Already ACS patient, aspirin. Aspirin or the clot option E, epsilon.
Okay, you want me to lock E. You're 100%
Yes, sir.
sure about it?
Yes, sir.
He says he's 100% sure. All right, lock E. Oh, you missed this one too. Goodness gracious. You know, we really wanted you to end on a high note because you were playing really well. But still, you've done well. And with this, we come to the end of this wonderful quarterfinal match, which was the second in line, the second quarterfinal match. And we all know that it's SICVD Thunders who have won this quarterfinal. Well done to you. Commiserations to PIC Warriors. But I think you played like Warriors, and well done indeed. So it was a great game once again. And we have our panel of experts, our umpires, and I'll start with Professor Mohammad Ishaq Saab.
Thank you, Hamza. Congratulations to the winning team, but I think PIC has given a good fight. Unfortunately, they had more mistakes, and that's how the SICVD became the winner of the game. Again, scenarios were very good, very pertinent. Questions were very relevant, and both the teams were quite prepared for the game. But PIC couldn't match the very good score, a big score by SICVD. So obviously they are the winners. But that doesn't mean that PIC lacks in knowledge, or they should be discouraged, or they should go home with any displayer. I think this is just a game, and this is just exchange of knowledge and a place where we try to get a stimulus and read more, see more, observe more, and become more perfect in future. So I think both the teams should be congratulated for taking part in the competition. ये जो कंपटीशन में पार्ट लेना भी एक अपनी तरफ से एक बहादुरी होती है और एक अचीवमेंट है. So I think, but again, 54 is a very, very good score in the tournament. I think one or two other teams have done that, and there is a team with a full score as well. So I think this kind of academic exercise is a great forum for learning, and for polishing themselves, and for going into the details, which otherwise we tend to forget. So I think both the teams should be congratulated for taking part, but obviously the winners are the winners of the day, and excellent performance by our moderator, and our other panelists will also have their valuable comments or opinion. One thing I would again advise the teams not to use unsure, uncertain, we don't know. But if you have taken a decision, if you have chosen a answer, you should go with certainty and with confidence. It may be wrong, but never mind. Thank you very much.
Thank you very much, sir, for your valuable input. So definitely this league is serving like a catalyst for all of us in terms of knowledge, not only for our students and the fellows. I think it's the faculty as well which is taking home a wealth of knowledge with all these questions. And I do have our other umpire of the day, it's Professor Abdul-Hamid Siddiqui Saab. Sir, yes.
Congratulations to the winning team. It was a tough target to fight for the PIC Warriors. They tried very well. So बकौल शायर मुकाबला तो दिल ना तवा ने खूब किया. But anyway, there's always room for improvement, and obviously it's a knowledge game. So one has to be winner and one has to be loser. Loser not in the sense that they've lost anything, but they have to improve on. Anyway, let's see how they behave next time.
Thank you very much, sir. Again, golden words coming from the master himself. And we have an extremely proud teacher and mentor there. We have Professor Javed Akbar Syal Saab. I hope he's there. Oh, I think we've lost him there. But we do have Professor Amber Ashraf. Ma'am, are you there?
Thank you, Hamza.
Yes.
Yeah, I'm here. Don't worry. It's a wonderful match. Congratulations to both the teams, and especially the one who scored better. That's always happened. But one thing which I want to discuss with the PGs all over there, it's a team effort, because a PIC team lose one or two questions just within 30 seconds they answer. The best thing is to discuss the thing, and with the team effort we always have a better option for the things. It's an exercise basically, not only for the academic point of view, but for the future when you people are going to play in the department, in the unit. Always respect each other opinion and discuss the thing, and then come up with a better answer. So this is a learning point which I think is very important, and that's why I share here. But anyhow, it's a wonderful, wonderful match. No doubt, as you have highlighted, there's updated knowledge, which not only update our PGs, the youngsters, but as a faculty, we really enjoy these type of the matches. And my opinion is most of the PGs who are not taking a part in it, they must come and join us, so that for the future we can improve our basic knowledge and we apply to our patients as well, so that the outcome will be better. Thank you to Wilson Pharmaceuticals. Hamza, to you, the other Hamza who always give me a reminder, I have to rush to another university, and that's why in between I saw his message and just joined on the very first question. Thank you very much, Ji, and good luck to all of you.
Thank you very much, ma'am, for your great tips, like always. And yes, it's Hamza who actually keeps all of us on our toes, and he's there to remind us. Wilson has done a wonderful job, and I think this tip is extremely important for all of you, especially when you're answering your MCQs. Always go through the STEM carefully and then go through the options carefully, because in that one question we know that it's Takotsubo cardiomyopathy, which is stress induced, so you had female gender, and the next one was stress and you missed that. So, and that's why the answer was both of them. So you can have, you know, there an option lying which actually embodies two of the options. So read it well, be sure, discuss amongst yourselves, and I think it's a team sport, it's a team game, and it's always the team that actually does the best for the patients when we are dealing with the patients as well. And cardiology and intervention is all about teamwork. So brilliant performance, I think, by both the teams. And we know that it's been SICVD Thunders who put up a wonderful score of 54. It was always a pretty high scoring game. It was a tough challenge for PIC Warriors, but then they did have a stutter in the start, but then they've really worked hard for it, and we could see that they were also prepared well. It's just that, it could be somebody else's day, even when you are really prepared for it. This is what life is all about. We keep winning, but we also lose some as well, and we should be prepared for it, and that should actually encourage us to take a bigger leap forward. And we are always improving all day long. So with this, we now come to the end, and I just want to thank you all for your time, and we'll be back soon with another wonderful match. Until then, it's Allah Hafiz from our side.